All right, guys, so today we're going to go over the assessment of the ankle. So we'll start with active range of motion. So again, active range of motion is testing the inert and contractile tissues. So we want the muscles to pull on the bones to cause movement. Okay, so the first thing I'm going to do is I'm going to try to communicate with the person to get them to do what I want them to do. So the first movement I'm going to get you to do is I want you to try to bring the toes towards your shins. Awesome. So then I'm going to come in, I'm going to make sure that I'm looking to see if there's any obvious differences in range of motion. If there is, then I'll ask, is there any pain or problems with that? And then I'll get them to relax. The next thing I'll get them to do is point your toes toward the ground. Awesome. Take again a good look to make sure it looks even. Any pain or problems with that?
No.
Awesome. So now is going to be inversion and eversion. Inversion and eversion is probably the hardest one to communicate because a lot of people don't understand the general cues that we give. What I would recommend saying is to say, I want you to turn the soles of your feet to face each other. Okay, so they should ideally do this kind of movement, just like that. If they start to do any kind of movement with their hips, do you want to demonstrate what a hip movement would be like? Yeah, so they've completely rotated their entire leg now. Okay, they might even kind of bend their knees and try to bring the heels and soles of their feet together. Okay, kind of like they were sitting cross-legged like this. Yeah. Okay, so the biggest cue is, again, try to get them to just turn their foot and not the hips or the knees. Okay, so if they still can't manage to do this, then you can go in and just guide them and say, no, I want you to turn the sole of your foot inward, like you were rolling your ankle. Okay. Once they've done that movement and I've noticed that it looks pretty even, again, you ask if there's any pain or problems, then you'll move on to eversion. So eversion, I want you to turn the soles of your feet outwards, away from each other. Good. And eversion is not a very big movement, so it'll be pretty small, but that's what you're looking for. Again, active range of motion, you want to communicate what you want the person to do. Passive range of motion, we're going to get them to stay nice and relaxed. I'm going to be doing the movement for the person. So we're testing the inert tissue, the non-contractile. So that's bone, ligaments, joint capsules, that kind of thing. So one hand is going to go on the joint. One hand is going to kind of cup the heel just like this, and then his foot's going to rest along my forearm. From here, I'm going to do dorsiflexion. So I'm going to take his foot and I'm going to apply pressure to get his foot and toes closer toward his face. And every time I'm doing this, you want to do about 3 to 5 passes. And every time toward the end, I'm applying a little bit more overpressure. So on my last pass, I'm really pushing in. And if you tell by my body stance, I'm standing on the side of the table so that I'm able to actually apply a lot more pressure and force to get full range of motion. Okay, you can actually apply a lot more because the calves are going to start to stretch pretty early on. So you really want to try to provide that overpressure to get that end feel. Okay. With plantar flexion, my hand over here is still on the joint. This hand has gone from here now to the top of the foot. And all I'm doing is pushing down. I'm bringing it back up and then I'm pushing down. And I'm evaluating the amount of plantar flexion that his foot gives me. And again, toward the end of my last pass, I'm really applying overpressure to see that end feel. The hand that's on the joint, again, we're trying to feel for any clicking, catching, grinding. Just notice any kind of crepitus. So we're seeing the quality and feeling the quality of the movement at the joint. And then we're evaluating the full range of motion as well. Okay. We're going to also do inversion and eversion. So for inversion, what I will do is I'll literally wrap my hand right around the bottom. So my thumb comes up over the medial side of their foot. My fingers are on the lateral side. To show you on this side, looks like this. Okay. So I'm gripping here, this hand's still on the joint, and now I'm going to be rotating them in. And I'm going to do my 3 to 5 passes, and again, my last one, I'm really applying overpressure to feel the ligaments, those lateral ligaments on the side of the foot, stretching. Okay. For eversion, now what you're going to do is my hand was like this, now I'm going to just slide it, so I'm like this, okay. Now my thumb is on the lateral side of the foot, while my forefingers are on the underside near the base of the fifth, so near that fifth metatarsal. So I'm here, my hand is still gripping, and now I'm trying to basically do supination, and I'm trying to push the pinky toe up in the air. Okay, so I'll show you on this side. So if my hand was here, then I'm doing this movement. And now I'm trying to stretch the deltoid ligament and see how far I can get with the range of motion. Okay. So again, make sure you're doing your 3 to 5 passes, applying overpressure at the end. Your next range of motion testing would be your isometric resisted. Isometric resisted is where we are evaluating the strength of the movement. Okay? So we want them to stay in a position, and I'm just going to try to push them out of that position, and they just have to hold it. Okay? You're going to be holding for a minimum of 5 seconds. Again, the reason we're holding for 5 seconds is if there's a neurological condition and they have like a nerve impingement somewhere along the track, then they might not be able to sustain the contraction for 5 seconds. Okay? So really make sure you're maximally resisting. You really want to see how much they can hold that position. So the first one, we're going to test dorsiflexion. I'm going to get his foot up toward the ceiling. I'm going to have one hand on the leg stabilizing. This hand does not matter where it is, you're just stabilizing. We're not at the joint. This hand's going to go on top right here, and I'm going to say on the count of 3, I'm going to try to push you down. Don't let me. So ready, 1, 2, 3, and 1, 2, 3, 4, 5. Good. If that position feels awkward, you could also come from this way where you try to pull them out of that position. Whatever works best is totally fine. Okay? But that's evaluating his dorsiflexion. For plantar flexion, I'm going to grip the heel just like I did for passive dorsiflexion. And I'm going to, again, stabilize with this hand. And then I'm going to say, I want you to push into my forearm like it's a gas pedal. So on the count of 3, you can go ahead. Ready? 1, 2, 3. Go ahead. 1, 2, 3, 4, 5. Perfect. No pain or problems with that? Awesome. So with the inversion and eversion stress tests, there's 2 different ways you can do this. You can do it primarily the same way that you had your hands positioned for passive range of motion. So if I go and put my hand like this, I'm trying to rotate him in. So I'm putting him into inversion. That means that if he resists me from doing that, he's going to be doing the opposite, which is eversion. Okay? So I'm going to say on the count of 3, I'm going to try to rotate you in. I want you to rotate out. Okay? So don't let me move you. Ready? 1, 2, 3. 1, 2, 3, 4, 5. Perfect. And then if I do eversion, it'd be the same thing. So I would come here, and I'd be trying to evert him. He's going to do inversion. So same idea. I want you to try to rotate your foot inward. Okay? 1, 2, 3. 2, 3, 4, 5. Perfect. Some people don't like that hand positioning, so what you might also be able to do is you can basically put your whole forearm up against the side of their foot, and they can do inversion and eversion into your hand. So it can be into your hand, into your forearm, whatever feels more comfortable. But at the end of the day, you really want to make sure that the movement is coming from the ankle. If, again, they start using their hip to rotate into the arm, then that's going to be a problem, and then you're not actually truly evaluating what you think you're evaluating. Okay? So make sure that if you are going to do that method, that they are really doing inversion and eversion.